Hi, everybody. I'm Anna Osborne, and I'm going to be talking to y'all today about interdisciplinary collaboration and management in nursing. So let me pull up my document to read from. So after completing the leadership skills questionnaire, I discovered that I'm in the moderate range for all three of the skills: administrative, interpersonal, and conceptual. I've had one official management position in my approximately 16 years of being in the workforce, although I have had unofficial leadership roles in other jobs, so I wasn't totally surprised at kind of being in the middle of the road. Um, I also have only been working as a nurse for less than 2 years, so in answering the questions, I kind of came from what I know about what nurse managers do, um, which isn't a whole lot, so I didn't expect my nursing management skills to be, you know, expert. Um, while reading chapter 7 of the textbook, this is for question 1, I was drawn to the 14 qualities for a successful manager as identified by Dr. Eugene Jennings on page 155 in the textbook, especially praises others when deserved and demands good work from everyone. I think that a good nurse manager will secure needed resources by understanding the group's problems and going to bat for the group. They know what their unit needs and won't stop until they get what they want. For example, on my unit, we're at the very top of the hospital, and we get all of our meal trays last. So breakfast was coming at 10 a.m. and lunch was coming at 2 p.m. and dinner was coming at 7 p.m. And our patients were very upset about this. They were hangry, to say the least. My manager, stood up for our unit and just hounded our AVP until he worked with dietary services to get our meal times changed. So now we kind of went in the opposite direction. We now get our meals at 7 a.m., 11 a.m., and 4 p.m. So it's taken some getting used to, but I'm really glad that I have a manager who won't quit asking for things that are important for our unit. So question 2, there are many books and research articles about what it takes to be a good leader and a good manager, especially in nursing. So our textbook is a good example, but I think a good non-nursing book that is probably applicable to every profession is The How to Win Friends and Influence People by Dale Carnegie. It's a really good kind of self-help book on personal confidence. Um, as a bedside nurse, the next step in my clinical pathway is to be a charge nurse and a preceptor for new staff. Um, and my hospital offers one-day classes on each of these positions, so I think that educating yourself about higher level leadership positions, even if it's, just precepting someone, will always kind of set yourself above people who don't do the research. So question 3, in my role as a bedside nurse, we need to have excellent rapport with the physicians and PAs and NPs. It's really crucial that that we have that communication with the people who are putting in orders for our patients. And this continues with higher level management positions. My hospital, my unit is part of a larger medical surgical division, so knowing the nurse leaders on the other floors is also important, as well as knowing the nurse manager for our whole division. It's also really important to have good relationships with other disciplines. So, for example, the people I see on a daily basis are environmental services, dietary services, PT, OT, phlebotomy, respiratory, and having a good rapport with all these disciplines will ensure that my unit will get what they want when they need it. Especially in the example of the meal times, we have good rapport with our dietary services people, so we were able to get a better mealtime for our patients. And as my mom likes to say, you catch more flies with honey than you do with vinegar. I was also reading an article on interdisciplinary collaboration from, this one was from Clinical Laboratory Science Journal, and a group of medical laboratory science students and nursing students were grouped together in a simulation where they had to collaborate um, on patient care and getting certain orders and getting certain tests done for the patients, and having that good communication, resulted in better patient outcomes. Um, and the patients surveyed after the simulation thought that kind of in the other direction, poor communication among healthcare professionals leads to an increase in medical error and jeopardizes patient safety. So it's really important that we kind of, just talk to and get to know our other people that we're working with that we may not see face to face. Maybe we're just talking to them on the phone, but um, it just provides better patient care. And then lastly, question 4. I'm a part of a really large hospital system, Carolina's healthcare system in Charlotte, North Carolina. So I think that we kind of have to have a vertical structure just because there are so many hospitals, so many different units, so many nurses that kind of fall under this one umbrella. And but it also kind of feels more like a horizontal structure because we get a lot of FaceTime with our excuse me, our AVP, who actually, he runs on our units, and he knows the employees by name, and it's just, a really good kind of horizontal, where there's not a whole lot of people that you see between him and the bedside nurse. So that's really nice. And as far as nursing models, I think I prefer the team approach because it facilitates communication not only among disciplines but among the nursing staff, like between the nurses and the techs. And also because of my patient's acuity level and our high patient to nurse ratio, meaning we have more patients than some of the other units. Having to do all the care for that many patients would, you'd probably be there for like 20 hours instead of 12 hours. So, my unit would have to hire like twice as many nurses to accommodate a more total care model. So that is it for blog 3. I hope y'all enjoyed it, and I look forward to seeing all of your videos. Thanks.